Good afternoon, good morning, and good evening to everyone. Thank you for joining this WHO EPI-WIN webinar on seasonal influenza prevention and control, national and regional perspectives. We welcome you all, particularly those of you joining from far away or at late or early times. For those new to EPI-WIN, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. With these EPI-WIN webinars and associated EPI-WIN digests, our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Today, we have a great panel to discuss our topic. Our speakers are Dr. Maria van Kerkhove, Acting Director at the Department of Epidemic and Pandemic Preparedness and Prevention in the World Health Organization, Dr. Nizar Maswadi, EPI Manager at the Ministry of Health in Jordan, Dr. Joshua Mott, Technical Advisor in the Department of Epidemic and Pandemic Preparedness and Prevention in WHO, Mr. Francisco Nogareda, Consultant at the Special Program for Comprehensive Immunization within the Pan American Health Organization, Mrs. Shoshana Goldin, Technical Officer in the Department of Epidemic and Pandemic Preparedness and Prevention in WHO, Professor Hitoshi Oshitani, Professor at the Department of Virology of the Tohoku University in Japan. And our moderator today is Dr. Gina Samaan, Unit Head for the Pandemic Preparedness Global Platform within the World Health Organization. Some housekeeping. This webinar is being live streamed on the EPI-WIN YouTube channel. The webinar is being recorded, and afterwards the recording will be available on our website and on our YouTube channel. The address will appear in the chat. AI featured interpretation is available today in French, Spanish, Portuguese, Russian, and Arabic. Please go to the interpretation globe icon to access and select the language. We invite you all to post your name, location, and organization in the chat box. We would love to hear where you're joining us from. Please add any questions you may have to the Q&A box, not in the chat, so we can more easily keep track of them. So without any further ado, I will hand the floor over to Maria van Kerkhove for the welcome of this EPI-WIN webinar.
Thank you, Agnesi, and hello, everyone. So I'm Maria van Kerkhove, sitting here in Geneva at the World Health Organization. Good morning, good afternoon, good evening, and thank you so much for joining us for this important EPI-WIN webinar on seasonal influenza prevention and control. So today you have an incredible group of experts and panelists to discuss this, which we will get to very, very quickly. But we really want to highlight the value of influenza prevention and control for epidemic and pandemic preparedness. Seasonal influenza, I have three key messages, which I know will be reinforced by all of the speakers today. Seasonal influenza prevention and control includes the use of all available tools. This includes vaccines, but it also includes antivirals and other therapeutics and public health and social measures that prevent infections, reduce morbidity and mortality. And as countries in the Northern Hemisphere are currently experiencing their colder autumn and winter months, we will see seasonal influenza outbreaks, and this is a good moment to reflect on the national seasonal influenza prevention and control programs. What works well, what doesn't, what needs to be strengthened. And for those of you who are in the Southern Hemisphere, it's really helpful to consider the 2023 influenza season to prepare for the next season in 2024. Second main point, seasonal influenza vaccine is high on the agenda for many countries, high income as well as low income countries. And this is important for a number of reasons. First, prevention. We need to protect those who are at risk for severe infections, such as older adults. We need to look at vaccination as a management of response, so better management of outbreaks, which we can expect to see every year, and preparedness to make sure that our systems are organized and ready to surge should we be dealing with a pandemic virus. WHO's Immunization Agenda 2030 highlights the importance for countries to strengthen immunization policies and service delivery throughout the life course so as to ensure access to life-saving vaccinations to children, adolescents, and adult populations. We have learned so much in past influenza seasons, as well as during the COVID-19 pandemic. And COVID-19 vaccination, as well as influenza vaccination, is really important to prevent infections and prevent severe disease and death, most notably, and especially among our highest risk individuals who are health workers, older adults, pregnant women, and people with chronic conditions. I will stop there, but thank you to all of the panelists who are speaking today. It's really wonderful to see you on screen and to continue to work with you for many, many years. And I think with this, I pass over to you, Gina. Over to you, Gina.
Thank you, Maria. Welcome, colleagues, and thank you for those wonderful remarks. As Maria said, colleagues, here we have an opportunity to learn from lessons. Let's look ahead. We're going to start with a few slides from our esteemed colleagues on the call today to set the scene, and then we'll have panel discussion and very much welcoming your questions. So, first scene setting event to our dear Dr. Josh Mott at WHO. A presentation, Josh, please, on the global influenza strategy, prevention and control measures. Set the scene for us.
Sure. Thank you, Gina. Thank you, Maria. And hello, everyone. I'm Joshua Mott. I'm going to tell you a little bit about the global influenza strategy launched in 2019. And it's the framework for which all of the important work and preparedness that we're going to hear about today fits within from the WHO perspective. Why do we have a global influenza strategy? Because there's an important burden of seasonal influenza each and every year, and there's an important pandemic risk associated with influenza each and every year. On average, seasonal influenza produces about 1 billion cases annually of influenza illness globally, with 3 to 5 million being severe, and up to 700,000 influenza-related respiratory deaths occurring from acute illness annually. That is actually something of an underestimate because influenza, like COVID, has impacts beyond respiratory illness, and this is just the respiratory burden, if you will. As I mentioned, influenza is also of pandemic potential. Its natural reservoir is within wild waterfowl, and influenza viruses spill over into domestic poultry, domestic animal populations, and occasionally humans who have little or no immunity to these novel viruses. These viruses, if they are able to then transmit among humans, can cause pandemics. There have been pandemics in the past, 4 in the last century, and there will be influenza pandemics in the future. In fact, every seasonal influenza A virus that's circulating now began its life in this world from a pandemic, and then gradually adapted into human circulation. So the future of pandemics is a certainty. Next slide, please. So influenza is an important example of how we need to build capacity for pandemic preparedness and also prevent an important annual burden. Influenza circulates and affects every country every year, and programs for seasonal influenza prevention and control are essential for pandemic preparedness. That means the surveillance that we do, laboratory and epidemiology, the prevention and control measures that we implement, medical countermeasures like vaccines and antivirals, and public health and social measures, response mechanisms that we do for outbreaks in vulnerable populations every year, and the investigations that we undertake. These are undertaken, and these control measures and surveillance are implemented each and every year to mitigate the impact of influenza on our populations, to reduce morbidity and mortality. And when we do that, we're preparing ourselves for the same types of responses that need to be scaled up during pandemics. That's what makes seasonal influenza preparedness and pandemic preparedness so closely intertwined. For this reason, influenza capacity is an IHR core capacity for emerging infectious diseases. And much of the work in IHR is built around building upon these seasonal preparedness for pandemic preparedness. Next slide. So the global influenza strategy has 2 very high-level outcomes: to create better global tools and to create stronger country capacities. Next slide. When you think about better global tools, we want to promote research and innovation to address unmet needs. A lot of the focus happening at WHO and with its partners are on improving vaccines, which are our best prevention measure for influenza currently, and improving those vaccines, improve novel and universal vaccines to create broader immunity, longer lasting immunity, and to have faster and improved technology for the timelines of vaccine development and the timeliness of release. Importantly, at WHO, we have to make sure that these improved technologies are also accessed equitably by all persons and places in the population, in the global population. More effective therapeutics, antivirals, immune modulators, and other drugs need to be broadly available to those that need it, and not just those in higher income countries. There needs to be a better understanding of the virus and host response, and better detection methods. Our diagnostics and our surveillance strategies are all part of better global tools. We need to improve these tools, but we also have to optimize current use of tools. Our current vaccines remain an important and effective prevention measure, and we have to optimize their use globally, even while future improved vaccines are coming out. And the same is, we have to increase equitable access to antivirals and learn from the recent pandemic to better implement public health and social measures as well. Next slide. In doing so, this is where we have to also build stronger country capacities. We know many countries are unprepared for a pandemic, and we've learned our lessons from the recent COVID pandemic and the 2009 influenza pandemic as well. Our work is to strengthen country capacities for seasonal influenza and preparedness planning, and to leverage that backbone for seasonal influenza, for example, our surveillance systems, to support broader respiratory pathogen detection and response. Thus, preparedness for seasonal influenza can have even broader impact on preparedness for multiple respiratory pandemic pathogens. Every country has a prioritized influenza program that needs to be evidence-based, focused on optimized to fit their populations and highest needs and their resources, and to contribute to national and global preparedness and response and health security. Next slide. So really, it comes down to 4 strategic objectives. We're promoting research and innovation to address unmet public health needs. We're strengthening global influenza surveillance, monitoring, and data utilization. Expanding seasonal influenza prevention and control policies and programs to protect the vulnerable and create equitable access, and to strengthen pandemic preparedness and response for influenza to make the world safer. When we do that, we're not just making the world safer, but we leverage these technologies and these infrastructures to prepare for respiratory pandemics in general as well. Next slide. So the vision for 2030, the timeline of this global influenza strategy, is to attain the highest possible influenza prevention, control, and preparedness to safeguard the health of all people. We've done a lot of work, and we have a long way to go, and I think that's where a lot of the discussions will take us now on the rest of this seminar. Thank you.
Thank you, Josh, for setting that scene so beautifully. Colleagues, let's turn to hear something more oriented for countries and policy development and evolution and updating. Shoshana, over to you, please. A presentation and a bit of an interactive session, I believe, on the landscape of influenza vaccination programs and available resources. Shosh, over to you.
Wonderful. Thank you so much, Gina. So as Josh just mentioned, within the global influenza strategy, there is a very strong focus on seasonal influenza prevention and control policies and programs, and of course, how they contribute to pandemic preparedness. We'll be diving into this focus throughout the rest of the presentation, starting with a brief overview of what is the global context for national influenza vaccination policies. These are preliminary findings that are likely to be updated over the coming weeks and will be published shortly. But the key message here is that seasonal influenza vaccination policies are available in all World Bank income classifications, and that we're seeing seasonal influenza prevention and control programs globally in all 6 WHO regions. So with that, as Gina mentioned, we've got some interactive portions to today's webinar, and we've got our first question to the audiences. With this, if you can please scan the QR code and respond to the question. For the interpreters, I will go ahead and read the question and the responses out loud. First and foremost, the question to the participants: is influenza vaccination available in your country? And the response options are yes, no, and not sure. We'll give just a moment for our colleagues to respond. Okay. We've got more than 60 respondents already in the Slido poll, and we see a very strong consensus that, in fact, yes, seasonal influenza vaccination is available in most of these participants' countries. Okay, thank you to all who have responded to this question. We'll have another question coming up for you shortly. With that in mind, WHO has developed guidance for countries about how best to implement seasonal influenza vaccination programs and who should be vaccinated against influenza. About 18 months ago, WHO issued new recommendations that replaced the previous recommendations from 2012. The focus of these recommendations is really on seasonal influenza vaccines and vaccination programs, while its primary audience is national public health officials and immunization program managers. It's interesting as well to the general public to understand who WHO is recommending for vaccination. In addition, health professionals need to have a good understanding of those target groups so that they can ensure that they are advocating for the right patients to receive vaccines, etc. And many other groups have found this to be helpful. So we'll give a quick highlight of some of the information provided in that position paper. First and foremost, for countries that are considering beginning or expanding their influenza vaccination programs, WHO recommends the following target groups: health workers, individuals with chronic conditions, older adults, which some countries can constitute to be above 60 years old, others might say at 65 years old, that is at the country's discretion, and pregnant women. If the country is interested and has the resources to do so, WHO also recommends considering other types of groups, such as children, people who live in high concentration settings that may not be able to move around freely, for example, prisons, refugee camps, and group homes, disadvantaged populations, and indigenous populations. But ultimately, it really is up to the country who they determine to vaccinate against influenza based on the local context and evidence, and of course, the program feasibility, most notably, the resources available to procure and actually deliver those vaccines. WHO does recommend annual seasonal influenza vaccination prior to the beginning of the season. For our colleagues on the call who might live in tropical or subtropical areas, we often get the question, what does that mean in terms of prior to the influenza season? What if it's circulating year-round? For these countries, WHO recommends vaccination prior to the start of the primary period of increased influenza activity. So there's typically waves of influenza activity throughout the year. Countries can look at their surveillance data, as Josh mentioned previously on this webinar, to identify when is that primary period and plan to vaccinate in advance of that. So our second question to the group is, have you been vaccinated against influenza this year? So again, if you scan that QR code, your options are yes or no, and we'll give you just a few moments to be able to respond to the question. And we can see that as the answers come in, we're seeing some fluctuations, but consistently we are seeing amongst participants that is a majority yes, that participants have in fact been vaccinated against influenza this year. So that does help to protect you against severe influenza disease and may also serve to help protect loved ones as well. As we think about seasonal influenza vaccination programs, WHO has developed a number of resources that may be useful for countries to be using, but also for colleagues, whether it's health professionals or scientists or researchers or the general public, as they'd like to learn more about seasonal influenza vaccination. The first resource I'll highlight is a policy brief that I'll talk about later again in this presentation. It just launched about 10 days ago, and it includes the key elements of a strong seasonal influenza vaccination policy. Our second core resource is a tool that helps countries to better understand the behavioral and social drivers for influenza vaccination. That should be published on the WHO website next year. Later in this webinar, we'll be hearing from our colleagues in Jordan about their experience using that tool. And finally, a resource set that might be useful for anyone on this call. We've got a vaccination toolbox. It includes trainings, guidance, campaign materials, and all sorts of other useful resources for people interested in learning more about seasonal influenza vaccination and in strengthening national programs or policies. So here is that brief overview of the policy brief that I mentioned. We are very thrilled to have this out into the world. We received many questions from regional colleagues and national colleagues about what does make a successful seasonal influenza vaccination policy and program. So WHO has put together this policy brief outlining what are some of the core components that should be included in a seasonal influenza vaccination policy. Starting with the motivation for the country to have the program, an overview of the evidence already available on influenza circulation, its burden of disease and economic burden, if available at the national level or regional or global information, clarity on how that national recommendation was developed, and understanding who are the target groups and the estimates of those populations, the different types of vaccines that are available and cost so that the country can determine which to use when they're vaccinating, a brief overview of where vaccine is being supplied from, how it will be delivered, how the vaccination campaign will be communicated and ensure that the appropriate target groups have the information they need to actually go receive the vaccine. This is really important, and oftentimes we think not particular attention is paid to it for seasonal influenza vaccination, but how to document and report that that vaccination happened, continuing to conduct research, as Josh mentioned earlier, and very importantly, ensuring there's sufficient funding to be a sustainable program. We do encourage that policies are reviewed every 3 to 5 years and updated as needed. Within that policy brief, we do also have links to useful resources. So we encourage you to take a look at that policy brief and to click over to other resources that may be of interest. As we're talking about seasonal influenza vaccination programs, we wanted to just briefly highlight what it means in terms of the global supply and production capacity. WHO does look at this every few years, and what you can see here on the screen is the places where seasonal influenza vaccines are in fact manufactured, which is in 31 countries around the world, primarily in high-income countries, but also in some lower middle-income countries and upper middle-income countries. You can also see the breakdown of different types of vaccines, and very importantly, what the global production capacity is. The reason this is so important is that seasonal influenza production capacity can be converted to pandemic influenza vaccine production capacity in the event that another pandemic emerges. We've got a number of useful resources here. If you'd like to learn more, these slides will be shared online, so feel free to click on these links when you have the PDF of the slides available. And with that, I'll turn it back over to our moderator, Gina.
Thank you, Shoshana. Colleagues, we've heard an updated policy brief from WHO, the considerations. Thank you very much, Shoshana, for that briefing. And these slides are going to be available online for colleagues who'd like to access some of those tools and resources, including the ones coming up. Now, as we look ahead and in the session to discuss with our panelists and experiences from countries and regions, let us first hear snapshots from them. So first, let me welcome Dr. Nizar. If you are here with us from Jordan, hopefully I can hear you, to turn to you to give us a flavor of the experience in Jordan. Over to you, Dr. Nizar.
Good afternoon. Nice to meet you all, colleagues. Sorry because my voice will not be clear because I am in my way, one of the governorates. Briefly, just for the current activities, according to the support seasonal influenza vaccines in Jordan, influenza vaccines just to fix I review it when influenza vaccines started in Jordan. It started to be used in Jordan in the mid of 90s. Also about the formal seasonal influenza vaccination policy will strengthen the program, and the Ministry of Health in collaboration with the National Immunization Technical Advisory private sector and other experts in Jordan for developing the first we are already developed the first draft of the influenza vaccination policy, and we are now going to the legal departments and other logistics for the policy. Also, the policy development was supported by WHO, ensured by the vaccination introduction. Also, for the last support uptake of the vaccines, Ministry of Health also conducting educational sessions for Ministry of Health, health workers, primary health care centers, and hospitals to address barriers for influenza vaccination. As I back now for one of the far away from the capital city to see how the distribution of seasonal influenza, also educating the public on the importance of influenza vaccines before the season through national interviews on media outlets, defining the WHO tools for understanding behavior and social drivers of seasonal influenza vaccination by field testing them on 2 primary health centers. Thank you for support. Really appreciate the support. This year we purchased for around 90,000. Only we have now 400 seasonal influenza in the public sectors. In the private sectors,
Dr. Nizar, we've unfortunately lost you. We'll put you
there
on
is
mute.
any questions?
Thank you very much. We've lost you at the end, but we'll come back to you in the Q&A. So thank you for those inputs, and really appreciating hearing the perspective and experience of Jordan. Colleagues, let's turn now to our regional team in the Americas. Dr. Francesco, working in the Americas on seasonal influenza vaccination programming. Please share with us some thoughts and experiences. Over to you, Francesco.
Thank you, Gina, and hello, colleagues. I will just provide some brief overview and some figures of the seasonal influenza vaccination in the Americas. 39 out of 44 countries, the 89% in the American region, are currently vaccinated against seasonal influenza in the priority groups. On the left side figure, you can see the number of countries by priority group. You can see all of the 39 countries, the 100% are vaccinating against seasonal influenza to healthcare workers. 97% are vaccinating in elderly, 90% in pregnant people and people with comorbidities, and 30 countries are vaccinating children. In the middle, in the pie chart, you can see the number of countries by using the different vaccine composition. 14 countries in the region are using the Southern Hemisphere formulation, and 25 countries are using the Northern Hemisphere formulation. And on the right side, you can see the number of doses distributed through the PAHO Revolving Fund for access to vaccines. The PAHO Revolving Fund is a regional instrument to provide vaccines to countries at lower price. And as you can see, the demand of doses has increased since 2016 from approximately 23 million doses to more than 30 million doses in 2023. There are 32 countries currently using the revolving fund for accessing to the seasonal influenza vaccine. Additionally, we have the PAHO region, a regional vaccine effectiveness network, is the REVELAC network. This network was established 10 years ago in 2013 and uses the SARI Sentinel surveillance system already in place in countries and provides annual estimates for influenza vaccine effectiveness every season in the Southern Hemisphere. Currently, there are 5 countries participating in this network. We have Argentina, Brazil, Chile, Paraguay, and Uruguay, providing their data to get us to obtain the vaccine effectiveness. As you can see on the right side, this is an example of the estimates. We obtain vaccine effectiveness by type and subtype of influenza virus and by priority groups, elderly, people with comorbidity, children. So that would be from my side. Thank you, Gina. Over to you.
What a rich data set and quality information. Thank you very much, Francisco, for the America's perspective and experience and data monitoring as well. The systems are incredible. Colleagues, seasonal influenza prevention and control relies on multiple tools and technologies. As we heard from Josh earlier in the call, there is the need to think about all the different prevention and response tools in our toolbox. So we'll hear now from our colleague, Professor Hitoshi Oshitani, about the use of antivirals for influenza in Japan. Professor Oshitani, over to you.
Okay, Gina, thank you very much. And good evening, good morning, and good afternoon. My name is Hitoshi Oshitani from Japan. And as other speakers clearly indicated, the vaccination is an important tool for the influenza prevention and control. But we also have another tool, which is antivirals. And in Japan, we are using a lot of antivirals. And different type of antivirals are available and recommended in Japan, as shown in the slide. And these antivirals have different mechanisms and also the different route of administration, oral, inhaled, and intravenous type of drugs. And as I mentioned, antivirals are commonly prescribed to patients with influenza in Japan. The government recommend the antiviral to be taken by those at higher risk of influenza, the complications. But the clinician can also prescribe antivirals to non-high risk patient based on the clinical judgment. And actually, the patient is the confirmed influenza are taking antivirals in Japan. Then we are probably using more antiviral than any other countries. And antivirals are also the effective for prophylaxis. And the antiviral for prophylaxis can be considered in certain settings, such as an outbreak in the hospital or long-term care facility settings. But there are some the important the conditions for antiviral to be effective. The antiviral should be given as soon as possible after the onset of illness. The antivirals are basically more effective if those drugs are given within 48 hours after the onset of illness. And also in Japan, we are using a lot of rapid antigen test, lateral flow test, to confirm antivirals, to confirm the influenza virus infections in outpatient settings. And these the rapid antigen test and the antivirals are covered by health insurance. That's one of the reasons why we are using a lot of antivirals in clinical settings in Japan. And over to you, Gina. Thanks.
Thank you very much, Hitoshi, for the input on antivirals. Stay with me. Let me ask you the question, Hitoshi. Clearly, it's used in Japan for seasonal influenza control and patient care. Can you reflect? You've been in the influenza public health sphere for a very long time. How do you see the use of antivirals for the purpose of pandemic preparedness and response?
Okay, so in Japan and also in the many other high-income countries, we have the stockpiles of antivirals, the different antivirals, to be prepared for the pandemic. And we are not sure what kind of viruses would cause the next pandemic. but the influenza pandemic may occur anytime. And during the initial phase of pandemic, we do not have vaccines. Vaccine may not be available, and but still, for influenza, we have antivirals. And some data indicated that antivirals are effective in reducing the severe complications, the hospitalization and the death. And we still need more data, but that's why the antivirals are still the important tool for the next pandemic, which might be caused by the influenza viruses. Thank you.
Yes, thank you. That's very, very sage and wise advice. Let me turn now to Dr. Nizar. If we can have you on screen, Dr. Nizar. A question for you. With all the programs that you mentioned, how have you incorporated learnings from COVID-19 and past pandemics? How has that influenced the activities that you are doing now? Dr. Nizar. Let's come back to Dr. Nizar. Let me turn to Francesco in the Americas. A question to you. Can you give us examples? And there's really a wonderful push globally by countries, ministries of health to continually strengthen primary health care. Can you give examples of where seasonal influenza prevention and control measures and activities are being implemented and integrated into primary healthcare delivery?
Thank you, Gina. Basically, seasonal influenza vaccination campaigns are conducted annually in the countries with really strong communication components, which explains who are the priority groups, who should be vaccinated, when, and where to go to get the vaccine. In the American region, we use the vaccination week of the Americas, which usually happens at the end of April every year as a kickoff event for seasonal influenza vaccination campaign in the Southern Hemisphere. As you mentioned, seasonal influenza vaccination is integrated in the American region in most of the countries in the routine immunization program. And it is usually conducted at primary healthcare centers. For instance, for pregnant people, vaccination is conducted by the midwives during the antenatal care visits. Overall, every year in the American region, excluding Canada and the United States, more than 100 million people are vaccinated against seasonal influenza. So it is very important and a strong program in the American region for preventing influenza virus infection. Thank you.
Thank you for that. It's excellent to hear. And as you say, the routineness of it means it has to be integrated. Let us turn for a moment now to think about data, and maybe Shoshana and Josh, these are questions to you and really pulling from what we're hearing from the Q&A inputs received from participants on the webinar. Do we have a sense of the number of countries that have vaccination campaigns or vaccinate their populations? Josh, over to you.
Thank you so much. So in 2022, WHO received from 126 countries information that they are using seasonal influenza vaccines either in their private and or public sectors. Now that may in fact be an underreporting because some countries did not complete the WHO-UNICEF joint reporting form on immunization for influenza. But that is the current information that we have, 126 countries.
Wonderful. And I hope we see an increase as the policy brief is rolled out through regions and teams at WHO working with ministries of health and other partners. This really serves an opportunity to strengthen those programs and increase the number as deemed relevant and priority by other countries. Josh, a question to you. We're getting questions from the field, from participants around antivirals, monitoring effectiveness. Tell us about the systems that exist to monitor such data about the effectiveness?
Sure. I put in the chat for some people, there's the Global Influenza Surveillance and Response System. It's a long-standing network of surveillance systems built around sentinel surveillance and, importantly, the associated laboratory platform that shares information, viruses, and uses that information to drive national and global decisions for the prevention and control of influenza. It's participated in by 126 different countries. And now within these countries, many of them, through the capacity built through participation in GISRIS, are able to have a seamless linkage between metadata, clinical data, epidemiologic data, and the laboratory data, the molecular results and the genetic sequencing results associated with respiratory illness cases. When that's influenza, you can look at those results and you can relate it back to their treatment patterns and the treatments used. But then you can also, in many of the laboratories, assess antiviral performances and to monitor the viruses if they have markers of resistance, as well as the effectiveness of treatment. Now, obviously, some countries are much more capacitated to do that than others, but through this network, we do monitor treatment effectiveness along with many other important epi and virologic considerations.
Thank you for that answer. Professor Ashitani, would you like to comment about the Japan experience on this one in terms of monitoring antiviral susceptibility? It's a question that's come up in the Q&A.
Okay, so we have a National Institute of Infectious Disease, which is a WHO collaborative center for influenza. And they are routinely monitoring the antiviral susceptibility of antivirals against the different strains of the influenza. And we also have the prefectural, the public health laboratories, which are collecting the influenza strains. And then the National Institute of Infectious Disease is monitoring the antiviral susceptibility.
Thank you for that. I want to turn to some questions around the acceptance and demand for products. And I think we've lost Dr. Nizar, but perhaps Shoshana, we did hear from Jordan's experience of validating and testing some of those tools around acceptance and demand. Do you want to comment further about what these tools are, what they're trying to do, and how they can help countries?
Absolutely. Thank you, Gina. So with great thanks to Dr. Nizar and the other colleagues in Jordan for the work on this tool, we are also conducting a similar process in South Africa on the English version of the tool and in Argentina on the Spanish version of this tool. What the tool is a group of both quantitative and qualitative questions that can be asked to people who are eligible for seasonal influenza vaccine, as well as key decision makers for the program. So these could be key people inside of that health facility. It might be health workers who are actually vaccinating. It could be policymakers to understand what are the barriers and enablers of seasonal influenza vaccination. The objective is to help countries to gather this information and then be able to respond to the challenges that are identified.
Wonderful. And so it's a survey approach, is that right?
Absolutely. It's done through interviews. So it collects a lot of really useful information about the way that seasonal influenza vaccine uptake is happening, but it also helps countries to understand a lot about their program structure and ways that they can refine their program more holistically.
Brilliant. Thank you for explaining that. Dr. Nizar, I see you're back with us. Question to you, if you can hear me okay. You talked a lot about the education of health workers, the rollout of the program, the refining of the tools that exist. Can you tell us, when you're thinking about this in the context of COVID-19 and the pandemic learnings, the changes that have happened over time, how is that influencing your seasonal influenza prevention and control program, i.e. the pandemic experience and how it's shaping your road ahead? Dr. Nizar, can you hear me?
Sorry, hi again, because I cannot hear you very well. But if you ask me about the COVID-19 and healthcare workers,
yes, indeed, it's about how your experience with COVID is shaping your seasonal influenza vaccination policies. How are the learnings from the pandemic shaping your way forward?
Is very bad because I am in my way. Sorry. Okay.
No worries. We'll come back to you, Dr. Nizar.
Okay.
Let me go. Thank you. We do have more questions around data, and this is seeming of great interest to colleagues attending the webinar. Josh, maybe I can turn to you again about other areas of where data needs to be carefully monitored. Questions about the surveillance systems, the sites that are submitting the data for us to monitor these trends. Can you tell us what's happening in this space to further strengthen that monitoring system?
Sure, there's lots of monitoring that has to happen for influenza. We have to monitor each and every year. I think this is what you're asking, Gina. Each and every year to understand when seasonal patterns occur at the national level, when are our epidemic periods, and we have to monitor the viruses that are in circulation, as has been discussed a lot in the chat. We also have to monitor who's most at risk and most affected by those viruses and at risk of having severe complications. Within a season, our national policyholders need to know, how bad is that season? Will this be worse than most? Do we need to advocate for having more resources ready for this influenza season compared to past seasons? And a lot of the work within GISRIS and with WHO involves setting thresholds and understanding just how bad a current season is, the groups affected and the viruses causing it. While we're doing all of that, the laboratory platform has to be there to support the early warning networks for IHR core capacities that must occur in each country every year as well. And these seasonal platforms, the mechanisms for getting and testing specimens and collecting data, and then the laboratory itself needs to be linked to the outbreak investigations that need to be happening in each country every year. So when there are cases emerging at the animal-human interface or outbreaks of respiratory pathogens of unknown origin, our routine networks can support the rapid diagnosis of those outbreaks to see if something new is emerging. And again, that's how all of this routine monitoring relates to pandemic preparedness and being ready for the next pandemic as well.
Thank you, very useful. Francesco, back to you. You showed a wonderful graph of the proportion increasing in country requests for vaccine doses and up to around 30 million in latest years. Can you elaborate further as from that journey from 2016, what are some factors that have led to that increase over time? What is driving that demand?
Thank you very much, Gina. Indeed, the demand of influenza vaccine has increased significantly in the last years. And this is probably because countries are more and more vaccinating more people, expanding the priority groups in their countries. I showed the figure for accessing the vaccines through the PAHO revolving fund. Other countries are using bilateral agreements with the manufacturers. They don't use the PAHO revolving fund. So as I said, the PAHO revolving fund provides access to vaccines at a lower price, a lower cost for countries. So it strengthens the sense of community and Pan-Americanism to solidarity and share common objectives to have access to vaccine affordable prices for priority groups. The demand is linked as well to the 2009 pandemic, H1N1. Countries realized the importance of having a strong seasonal influenza vaccination program that really benefits for a better preparedness and response for pandemics. We notice in the American region that those countries with well-established seasonal influenza vaccination program responded quicker and faster and achieve higher vaccination coverage faster than other countries with weaker seasonal influenza programs. So again, it's not only benefit for individual group priority groups, it's also for better preparedness for pandemics. Over.
Thank you, Francesco. And I think it really does gel with what Professor Oshitani was talking about in terms of the value add of these different tools in our toolbox to control routinely, but then for their value add for pandemic preparedness and response. We saw in the COVID pandemic that in 2021 alone, 14 million lives were estimated to have been saved as a result of the vaccination. So if the routine vaccination happening pre-pandemic is then helping countries to route vaccination during pandemic, this really is a very important theme to continue. And thank you for all the work to all of you. Let me turn to Shoshana. Are there any burning questions, Shoshana, that you're seeing from the floor that we should be addressing?
Wonderful. Thank you so much. I see some really interesting questions about how to support uptake and higher coverage of seasonal influenza vaccination. I also see some questions about what are the difference between the vaccines that have 3 strains or 4 strains, and how do countries decide which vaccine to use? Maybe we can start with those 2 questions.
Sure. So Francesco, do you want to take the first one on helping countries on uptake? And I will turn to Josh on the second for the 3 or 4 strain vaccines. Over to you, Francesco.
Thank you. So I think it's really critical to understand the main drivers and reasons for non-vaccination in the population. As Shoshana mentioned, the best study, the survey tries to understand why the people are refusing the vaccine in these priority groups. So in the American region is a heterogeneous region, and we observed some low coverage in some priority groups in some areas. For instance, we see a high reluctancy in healthcare workers in the Caribbean region. So our efforts is to really understand why and the main reasons to elaborate actions to promote and advocate for vaccination in those specific groups in that region. So again, I think it's important to really understand the reasons to target the actions to increase the coverage in priority groups. Over.
Thank you. The importance of community engagement, absolutely, and a two-way dialogue in that process over time. Thank you, Francesco. Josh, over to you.
Thanks. You know, for many, many years, influenza vaccines for seasonal influenza were trivalent in nature. That means they had 3 different strains in them, 2 influenza A viruses and an influenza B virus. Over time, and with the global surveillance network, when we were observing that there was very frequent circulation of 2 influenza B type viruses, a B Victoria and a B Yamagata. And so a quadrivalent vaccine began to be produced by our manufacturing companies, including 2 influenza A's and both influenza B strains. Now, as we've gone through the pandemic and we've been observing, still with our surveillance, the circulation of influenza, it appears we do no longer see the circulation of B Yamagata, but we still need to make sure that our surveillance is as good as it can be to be absolutely sure that it's gone. And so now the global strain selection considerations, and it happens once a year for the Southern Hemisphere and once a year for the Northern Hemisphere, are looking hard at existing surveillance data, and will continue to make recommendations about the role of quadrivalent versus trivalent vaccines for their use globally. So keep staying tuned to the recommendations that come from that group.
Thank you, Josh. And it's absolutely showing the immense value of that global influenza surveillance and response system, GISRS, and how it drives coherence, best scientific practice. So thank you indeed for that. Shoshana, one more question, simple question around co-administration, influenza and COVID vaccines. What do countries do?
Absolutely. So WHO does recommend co-administration of influenza and COVID-19 vaccines if there's of interest to do that in the country. There is also potential that in the future, there may be vaccines that include both influenza and COVID-19 in the same vaccine itself. So while that's not available now, countries are thinking about what the program might look like if these two vaccines were to come together.
Thank you, Shoshan. It's upon people like Francesco and Dr. Nizar in regional country programs to have that foresight and think ahead about those what-if scenarios and how do we roll it out in due course. Thank you all. Colleagues, we have come to the end of this discussion. Thank you to the panelists, the presenters, for sharing their expertise, their experiences, and the latest policies. I will now turn back to Agnesi from the EPI-WIN team to close us out. Thank you.
Thank you, Gina. Thank you, Shoshana, and thank you to all our speakers for the wonderful discussion. So as we are coming to the end of our allotted time, I will wrap up by saying thank you very much to all our colleagues today, in the ones, for example, in charge of AI interpretation, the WHO colleagues who have worked on this webinar, and particular to the EPI-WIN team, Sarah S., Supriya Besbarwa, Priya Umachandran, Zhongfang Liu, and team Gabriela Santesso and Tim Nguyen, overseen by Dr. Maria van Kerkhove. Finally, thank you to you all for coming and for your questions. We have shared a link to a WhatsApp group that you can join if you wish to continue the conversation with each other. The recording of this webinar will be available at EPI-WIN website and on the EPI-WIN YouTube channel. An EPI-WIN digest, a slide set with key messages on this topic, will be published shortly. If you want to keep updated on future EPI-WIN webinars, recordings and presentations and the EPI-WIN digest, please subscribe to our mailing list. Both links will be appearing in the chat. We wish you a wonderful end of the year, and we hope you will join us for our next webinars in 2024. Thank you from the EPI-WIN team.